I received an email from Carlos. He wanted me to differentiate between a soft tissue damage and a structural damage. This is a really important concept for you to understand, because when we're looking at structural damage, you definitely need to go see a specialist. And especially if you've been an athlete for any period of time, athletes tend to have a very dangerously high level of tolerance against pain. So stop and think about this. When you're laying in bed at night and you feel that discomfort, when you get up and you start moving around, if the discomfort starts to subside, that's when you know it's soft tissue. If it hurts when you're resting and it's still throbbing when you're exercising, it's a pretty good indicator that you've got some structural damage going on there. Please don't try to push through it. You're only going to make the situation worse. Just got to be as blunt as I can possibly be. If you wake up and you start to exercise and the blood flow gets in and everything vasodilates and that pain goes away, that shows you it's more soft tissue related. Now again, you can have extremes on both ends. Don't take it as an absolute gospel, but I'm just answering the question in regards to what's an easy litmus test to differentiate between structural and soft tissue damage. Soft tissue starts to feel better with exercise. Structure hurts both at rest and during exercise. So if you're enduring something like that, please don't goof around with it. Go get it structured. Go get the injury looked at. Get with a specialist. They're going to get you onto the fast track back to, maybe they put you in a boot if it's something in your foot or leg. They may give you some kind of a sling to get the pressure off of if it's upper body. I'm just using some hypotheticals here, but think about it. The sooner you go see a specialist, the sooner you're back on the fast track to being healthy. Another aspect of his question was, what's the difference between using dry heat and moist heat? He heard me talk about this on my Coach Robb podcast. This is a very important differentiation as well, because the body is very smart. If you put dry heat on the skin, it's just going to cause that area to sweat. If you use moist heat, like if you submerge yourself in a bathtub or a jacuzzi, that moist heat will actually permeate the muscle tissue way more effectively. Not all of us have that luxury. Some of us only have a couple showers in our house. I understand. But if you're asking me what's going to be more effective, moist heat or dry heat, moist heat will always be more effective. Now, if we're dealing with an injury, you don't want to introduce heat until about the 72-hour mark. Because when you put the moist heat on there, it vasodilates, which could make the inflammation even worse. Now, going back to what if you don't have a bathtub or the ability to go into submerge, you can always take a washcloth, get it wet, put it in a microwave, warm it up. Just remember when you take it out, it could run the risk of burning you. But that's an easy way to do moist heat, especially when you have body parts like if you jack up the back of your neck, it's easier. Take that washcloth and drape it around your neck than trying to go into a jacuzzi or a warm bath all the way up to your chin. There are obviously heating pads that are out there that you can use them over and over and over again, throw them in the microwave. They do create moist heat as well. I've got them here at the house. I do both, just depending on the body part and the convenience of it. So keep all these things in mind. When you are dealing with an injury, I would prefer you to always be proactive. Don't ever make any assumptions. But today's video is more about getting you to ascertain the difference between structural versus soft tissue. If you happen to have a question such as this, please do me a favor, send it to me at contact@coachrobb.com. We're putting a video up every day, so please like and subscribe. Thank you for your time today, and I certainly look forward to seeing you tomorrow.